Okay, and we're back from break. Let's reconvene with Health and Human Services, Health and Wellness. Michael?
Good morning.
Good morning.
Wow, good. I just wanted to let you guys know that this budget was prepared before the COVID pandemic and all the financial uncertainties that it brought with it. We are under the new CCO 2.0 rules, and the way that the new rules were implemented by Advanced Health has changed the way we will do business. We used to be the behavioral health arm of Advanced Health. We used to manage that benefit. We no longer do. We are now just a provider of services. So that means about $4 million, or a third of that budget, is now managed by Advanced Health, and that is mainly contracts for contract therapists as well as hospitalizations. That leaves us with about $8 million that we will need for operations. Half of that will be capitated, which is similar to how we got our money now. We get it in advance, and then we submit claim encounters on a monthly basis that kind of report how we do that. The other half is now going to be fee-for-service. Fee-for-service is a lot more difficult, but David has put together a working plan based on other operations that make it work at fee-for-service. We have set our productivity goal for staff at 60%, which is the standard for that type of operation. In order to reach these goals, we will have to make some organizational changes, which means moving bodies out of kind of these group rooms into individual rooms so that they can see more clients, kind of one right after the other, which will help with the fee-for-service environment. We are also organizing our structure. I am moving all of the prevention programs under Florence, and all the med programs will be integrated under Eric. Eric will also oversee IT, the electronic health department, records, and front desk. Unfortunately, we had to discontinue the physical health integration team, which is our FIT program. We would have to assume more risk to go to a fee-for-service for that program, and I did not want to compound the risk we're having with the behavioral health fee-for-service program with an additional programs. We are planning on restarting the FIT program after we meet our behavioral health goals and get on solid ground again. And we think the soonest we would be able to do that was January 2021, which probably every month we go through COVID, it will probably push that out another month. When we bring back the FIT program, we're going to bring back 2 nurse practitioners instead of 1, which will actually make it a more robust program. As for public health, in addition to adding the prevention programs, the alcohol and other drugs, tobacco and problem gambling, we are focusing on identifying other sources of funding other than the state IGA and the other small restricted funds that we get, as these mechanisms do not cover our current expenses. All of these changes will be reflected in our budget presentation. Thank you.
So, good morning. I'm Rebecca Riddell. I'm the Finance Director at Coos Health and Wellness. So if we want to start with the organizational charts that were provided, the one on the top is the overall of the organization. So you'll see like the Board of Commissioners, and then the Health and Human Service Director, which is Mike. And then the 4 areas that fall underneath him. And then this does reflect then the new organizational model that Mike spoke to, where we have shifted folks basically to help balance things out, and then to go under this new model that we're having to operate under as the CCO has directed. So the second page is the org chart for the public health program, which I believe is the first up for us to discuss this morning. Yes, okay. So you'll see the different departments that fall under public health. So we have the clinic, we have WIC, we have the health promotions and preventions, which is shifted under public health now. As Mike spoke to, we have environmental health, the public health nurse, which is the home visiting program. We have public health emergency preparedness. We have someone from the CDC that is working for us now that we're actually not paying for, but they're here and they work under the program, and then our epidemiologist. So if you move to then the first stapled thing in your packet, that's the budget for public health. So you can see here the first page is the revenue projections. We have a beginning balance that we're projecting to stay relatively flat. I will say, as Mike spoke to, these numbers were prepared pre-COVID. We have quite a bit of money going out the door right now for the COVID response, and also a lot of potential money that may come in, from FEMA and the state and things like that. So where that all is going to end up, we don't know. So that's why we're just sticking with this budget right now. We have public health fees. Public health fees increased quite a bit because the amount that we're being reimbursed for the home visiting program from the state went up significantly, which was really good because they were that program was starting to not show sustainability, and so I think they've seen that across the state, and that's why they increased that. We have environmental service fees, environmental licensing fees. So the licensing fees went up slightly. The cost for the fees for the public went up a very small amount this year, and again, we don't know where that's going to end up due to the fact that lots of businesses are impacted by COVID, so we don't know how many new ones will open up or, relicensing for next year and things like that, so we'll see. We have maternal and child health and Medicaid. They're staying mostly the same. All of this section where the account numbers start with 331 on the left, that's all state money that's coming in. So we have emergency preparedness money we think is going to actually be slightly reduced, was the plan anyway for next year. So that's why that is going down slightly. We have just some other miscellaneous grants there. The children's health insurance is it's actually part of the outreach as far as getting folks enrolled in OHP and getting them on for services. The Homeland Security Grant, that one is a potential. We did receive some money from that this current year. We haven't actually received the funds yet, but we were able to buy the really big tent that maybe some of you have seen on TV or anything. So that grant is available again for next year. So we'll see if we are able to get that. WIC is an area that it's expected that the reimbursement rate might go down. I know the state is looking at how they are reimbursing for WIC services because there's a lot of different areas that are having problems sustaining the amount of services for the amount that we're getting from the state to do that. So the WIC department is one that has, for the last several years, been operating in the red. So that is one area that I know Mike has been focusing on, trying to find other funds to help support that program. General state support is expected to be flat. Public health grants, this is a line where we know there's usually funds that community members or community programs will donate to support services for public health. A lot of times we get funds from Zonta, those organizations, and that usually goes towards reproductive services for folks that don't have health insurance and don't qualify and things like that. This also just has some money set aside for any additional private grants that we might receive. So work for outside agencies, you'll see that increased quite a bit, up to the $150,000. So this is an anticipated amount that we might receive from Advanced Health as part of their obligation to support public health services as the CCO. That is a new thing. Like previously, that money was actually coming in through our behavioral health side and moved to public health. We don't actually have a contract for that right now, but there's been a lot of indication that they will support that. Travel expense reimbursement, interest earnings, relatively flat. And then we have Public Health Title 19. So this is actually just transferred in money from a separate fund. So this fund was set up many years ago as a separate way to keep track of Medicaid reimbursements, and we don't need to have it set up that way, so we're closing that other fund and moving that money into this one so that it's all in one place rather than in two. Are there questions about the revenue lines at all? No? Okay. So if you flip the page, then we have our wages section at the top. So this includes any step increases here, but also you'll see that it went up a little bit or significantly because of moving departments. So we moved some staff members from the health integration team here. Those are those prevention folks. So those salaries are now reflected here where previously they were reflected in a different department. We've got some extra help, which is our nurse practitioner that provides services through our clinic on a part-time basis. And then you have the normal benefits, insurance, things like that in the wages section. Any questions? Okay. So if we go down to materials and services, this section you're going to see a lot of shifting because we had previously had account numbers that were trying to reflect the entirety of what was going on in individual programs. So for example, we had a WIC account number, and that account number was used for supplies and different things that were needed, promotion, those types of things. That actually is an outdated way of doing things and doesn't follow federal guidelines for how to account for things. So we have shifted to what is, I think, the common way the entire county shows accounting. So you'll have supplies or in supplies. You'll have rent and things like that, where, you know, previously those were individual ones. So you'll see like the supply line, the very first line, doesn't have anything in prior years. Those costs are all actually reflected in the individual account lines down below. So you'll see several lines that show 0 now for the current year, and that's where those things have moved up. So we've got supplies and public health expenses. That's mostly the accreditation fees that we pay. So we did become nationally accredited. Our public health department did last year. So we have an accreditation fee that we have to pay to maintain that certification. There's equipment that is in here. The large equipment line item that's here actually matches the Homeland Security grant on the revenue side up above, so that would only be spent if we did receive those funds. We have an emergency response contingency line item that generally goes unused each year, but is there in case we have an emergency, and then we have those funds available to use. So, for example, like we're using them now for COVID. Postage and insurance premiums are pretty standard. So you'll see the maternal and child health and STD expenses are 0. So those are ones that have been dispersed out into discrete line items. The Medicare admin claims. So there is a program where we can submit our administrative time where we are reaching out to the public to hook them up with OHP services, and we get reimbursed from the state for that, but then they actually require us to match or pay half of those funds back to them. So it's kind of a convoluted process, but we basically receive twice that much money and have to pay them the $50,000 to them. So that's what that is. So the family planning and WIC, those are 2 line items that got redispersed. The public health Title 19 that is here, this is actually similar to those Medicare admin claims in that the funds that we receive for the home visiting program that did increase up above in the revenue side, we have a matching amount in expense we have to pay for that as well, and so that's what this increase is for here. So the sanitation, immunizations, EH licensing, the primary care services, all of those lines are now not going to be used going forward. We have telephone expense, which is mainly cell phones and fax machines and things like that. Reimbursed travel expense, so this is expense for travel that is usually being reimbursed from some other, normally the state program. So if they want us to go to a training and they're going to reimburse travel, we put that expense here. Public health grants, this line matches the public health grant revenue line from the previous sheet, which shows the possibility of grants received. So this would only be spent if we did receive those funds. Software license maintenance, and then we have contracted services. We have questions?
Neil or John, do you have questions?
No.
John, are you there?
Yeah, sure.
Can you hear me?
Now, yes.
Okay, sorry, no. No questions.
Greg? Sven?
Nothing.
None?
Okay,
Okay.
we're good.
So, the other pieces in the packet do give a little more detail for each one of those line items. Like the wages, it shows the folks that are, or the positions that are paid for under that, but I'm going to bypass those detail pages, okay?
Okay, so.
Unless there's questions.
Do I have a motion for Wellness Fund 005?
Sure, so moved.
Now everybody jump in here. Do you have a second?
Second.
Okay. Discussion. Any discussion? Hearing none. All in favor?
Aye.
Aye.
Okay. So now we have what, Title 19, Fund 113?
Yes, so this is the fund that I mentioned was previously carrying the Medicaid funds, and those are being transferred into Fund 005. So this is basically just showing the beginning balance rolling over and then the transfer out, which is going to close out this fund.
Oh. Okay. Need a motion for that.
Move tentative approval of Public Health Title 19 Fund 113.
Is there a second?
Second.
Okay. Discussion. Hearing none. All in favor?
Aye.
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 All right. Health and Wellness Fund 021.
Okay, if you want to flip back to your org chart packet, the next page after the public health is behavioral health. So you'll see how this is structured. So this particular fund does actually cover the next 3 org charts that are in your packet. So it has the behavioral health department, the health promotion and integration department, and then administrative finance department.
Okay.
Okay. So the first page of the budget for Fund 021 is the revenue side. You'll see that we are anticipating a lower beginning balance than we have carried in previous years. This is due to the change to the new model. It's going to take a little bit of time to change the operations to where we're receiving the same amount of funding or same level of funding that we were receiving previously under the fee-for-service model. So with that, we do anticipate using up fund balance this current year to get to that sustainability piece. And of course, you know, now with COVID, again, some of that work is somewhat on hold. We do have quite a bit of folks doing telehealth at this point as much as possible. But again, that's going to be on hold. So the beginning balance is probably going to fluctuate a bit. You'll see the second line is much, much larger than in previous years, and this is the anticipated fee-for-service revenue under the new model. So we have several line items that aren't used anymore, and then we come to our state support, which is remaining relatively flat. We're moving into the second year of the biennium, so we don't anticipate any real changes there unless something significant happens. Same with alcohol and drug tax, that's from the state as well. Then we move to the Oregon Health Plan. So this was the line where we were receiving all of the capitated payments previously. You'll see that this number is a third of what it was in previous years. So again, part of that is being made up in the fees that we will be charging as a fee-for-service model. But then there is a chunk that Mike spoke to previously as well that we just won't be receiving at all, but we won't have the expenses that were going out that were associated with that. there's other programs in the community that are just going to be supported directly now from Advanced Health. So those funds will not flow through us.
I have a question.
yeah.
On your behavioral health fees that you'll be collecting, is that mostly insurance? Is you paid by insurance companies? There won't be that much cash?
Well, most of it will come through Advanced Health, so it will be basically the same company, but instead of us being paid up front, they will pay us based on the services that we provide.
But it acts like
Yeah.
insurance,
Yeah,
you
it
know,
does,
so it's like
but, yeah.
their members
Yeah. You
have
send out a
insurance
bill-
through them.
You send out a bill to this company that covers covers this.
Yes.
Maybe stated differently, Advanced Health receives their funding from state and federal funds. Then when the county bills Advanced Health, that's where it comes from. It's not from private insurance. It's,
Medicaid dollars.
yeah,
Right.
I mean, state and federal
Yeah.
dollars,
It's all
yeah.
Medicaid dollars.
Oh, this is all Oregon Health. Okay.
Right.
Yeah.
Oh, okay.
So what, 6 or 7 years ago, the state switched over from the way that they had administered Medicaid to this coordinated care model
Right.
6 years ago, I
6
think.
years ago.
Yeah. And then they just passed a new contract called CCO 2.0, and that's what we're seeing now. That's why it's all changed again.
Okay, so then we have work for outside agencies, and you can see the note says this is for school-based therapists. So we are currently receiving funds from Advanced Health to support the school-based therapists, which that funding will end July 1. And we have contracts that we're anticipating with each of the school districts, and they will be funding part of the cost for the therapists that are out at the schools. We do also receive some state funding for that as well, so just that funding model is shifting. We also will be able to do some fee-for-service models for those school-based therapists if they're doing like regular therapy sessions with their students. So interest earnings is expected to stay flat. And then we come to another balance transfer. So this is very similar to the public health one, where we had that money that was being put into a separate fund, and we no longer need to keep them separate that way. So we are going to close out that fund and move those funds into this one. Are there any other questions about revenue? Okay.
John or Neil?
No.
Okay, so the next page shows the administrative costs for this division. And we've got wages at the top and staying relatively flat here, mostly just step increases. We have then, of course, the benefits that go with that. We did start splitting more positions this year with public health. So previously, there were several positions that were funded by this division completely, that public health wasn't having to pay for those services. And so some of that split is starting now, where we're having to look at that kind of model because of this change in the contract and the fee-for-service model. So positions that are split are on the administrative side, or positions like mine for finance, so the work that I'm doing for public health will get charged to public health. the work I'm doing for behavioral health is getting charged to behavioral health, those types of things. Under the materials and services side, don't think we have any real big changes here. Supplies and other expenses have stayed relatively flat. We of course have been, with the change, looking at some different things. Like I know on the equipment side or information technology, you know, we had some funds for desktops and laptops, and then now with COVID, it's like, we think we're probably just going to stick with laptops going forward so that, you know, the telehealth thing is all so much easier. We do have some Medicaid administrative claiming that happens on the behavioral health side as well. So we do have some funds set aside as a refund to the state of Oregon. These funds, we have some bills that have been coming through as part of our, since we were part of the CCO as their mental health division previously, there's all of these different indicators that they look at, and if some indicators are met or not, then sometimes money has to be repaid. So we still do have money set aside here just in case we have more of those come through, because the state's a little behind on sending those bills. But I would not anticipate it being that large going forward. Utilities, telephone have all stayed the same basically. Software license continues to go up. I would say that's probably an area that will continue to probably have to grow, just because, again, with the telehealth and maintaining everything on the cloud and things like that, it becomes more and more expensive to do that every year. And then you'll see a huge drop in contracted services. So this was, this is an area that, actually, let me look at that. And oh, yes. Sorry, I just had to take a look. So we had security previously that would be around the grounds, and we're not having that expense anymore. We weren't sure when we moved to the new building what was going to be necessary security-wise, and it doesn't seem like that's a necessary expense to have patrols coming at night and things like that, making sure everything is okay. We seem to be fairly safe, and that's great. There's also a decrease here for janitorial costs that we have been looking at moving perhaps in-house. I know that's still kind of under discussion as possibilities, and yeah, so those things have reduced that significantly here.
On a note about the security, probably, I'm guessing 3 weeks ago, I was over in the Coos area, and it's just when our C-19 started. And it was in the evenings, probably 7, 8 o'clock in the evening. I drove into the health and wellness building and then around to the back. And between that and behavioral or advanced health, here's this old dilapidated motorhome with the plugged into one of the light poles. I'm thinking,
Yeah, I think we've seen that there before,
Uh-huh.
and after they charge up or whatever, then they take off,
Oh,
but,
yeah.
yeah.
that was a little unusual. Anyway, just a comment.
done.
Go ahead.
Are there any questions about these administrative expenses?
I don't hear any, so we need a motion for,
So we actually, that was
Well-
just the administrative expense for,
I'm-
It's just the beginning.
so,
I'm
if.
on a fast track here.
Yes, so if you actually move to page 11, we will skip the detail pieces that go with that administrative section, and we will be on to the behavioral health expenses.
Here we are.
So,
Let's see, I thought we were gonna take the 1,300 separately from the 1,302, but apparently we don't do that. Okay,
You're the
I'm
chair.
getting
We
a
do
no
whatever you
nod
say.
from Megan. All right, moving to 1,302.
So for 1302 in the 021 fund, we have, again, the salaries and wages. So you'll see there's like a significant salary decrease here. That's actually due to movement of staff to the health integration department. That's the medical providers, so that's the psychiatrists that see folks. Also, folks that we have that help with medication management, those types of areas. All of that is being shifted to the health integration department, so that's that decrease there. And then you'll see clearly that then that has a decrease in all of the benefits that go with that as well. So then if we go to materials and services, we have supplies, which is general supplies, and then you have client supplies. So client supplies are ones that we assist the clients out in the community doing things, so that as part of their case management. So that's why those are kept separate in a separate line item. If we look at, we do have some contracts that we are keeping, so like the A&D intensive outpatient, we are keeping that portion of the contract, so you'll see those costs reflected there still. Then the next line item, chemical dependent outpatient, this was previously kept in the health integration department, and it's now being moved here, which is where it will be managed. Extended care facility, that's a piece that we are still seeing run through our books as well, but that's staying flat. Then you have telephone, training and travel costs, software license, and then the contracted services. You see the humongous $4 million decrease in contracted services, and those are the ones that I spoke about earlier, those contracts that we are no longer supporting ourselves, that have moved to Advanced Health. And if you want to see the detail of those contracts, which ones those are, that is on page 18. And are there any questions about the behavioral health classification of this fund?
It's quite a cut, 6.1 plus million. Wow. Any question?
No question?
Okay, moving on.
Okay, so if you go to page 19, that is the health promotion and integration section where that one starts. Again, you'll see the increase in wages. That's from moving the med providers into this department. Although we did have a few folks, the prevention specialists that moved from this department to public health as well, so shifting in and out. Then if you go to supplies and services, materials and services, most of this is to support that medical side of the house. So, got client supplies, some equipment. You'll see the chemical dependent outpatient and prevention education line items are zero because those moved to the other departments. Basic telephone, training and travel, software license, and then contracted services did increase here due to the med providers. So we do have one med provider that is actually completely telehealth that is not a employee. So we contract with a service, and they provide visits via telehealth. So we do have that is moved into this this line item from the previous department. Are there questions here?
Apparently not.
No?
I haven't heard any.
Okay, so that is it for the 021 fund.
So do I have a motion for the 021 fund?
I'll move we tentatively approve it.
Okay,
Second.
okay. Discussion, anyone? Neil, John?
Oh, no.
No? Greg? Sven? Melissa had to be on a conference call for a little short while. Okay, all in favor? Aye.
Aye.
Okay. And do we have this one last page? The Title 19 114 fund?
Yes,
Okay.
so this is, again, the same as the public health. We are closing this fund, so you'll see the rollover of the beginning balance and then the transfer out for the expense, and that fund is being closed and moved into the 021 fund.
Okay, so a motion on that fund.
I move we tentatively approve the behavioral health Title 19 budget.
The 114? Okay. Do I have a second?
Second that?
Sven? Okay. Discussion? John or Neil, discussion? No?
No.
Okay.
No.
All in favor?
Aye.
Thank you.
Bob, could I
Yes.
back up to 1305 for just a moment?
Oh,
Page 19.
okay. If I can find it amongst my stack of items here.
Page
When we just
19.
approved, just before this one,
Okay. Page what now, John?
page 19 of 24.
19 to 24.
Got it?
Yes, I do.
Okay, I was just looking at insurance benefits, and if my math is right, are they about 14% of regular wages? And typically that percentage has been running much higher than that, up in the 30% range. Are we sure that we've got enough money in there?
Yes.
Or do we just have to have some people in there whose spouses are providing health insurance or something like that?
Megan says we do.
Yes, the people in this department make a significant amount more than everybody else.
The psychiatrists, basically, yeah,
Oh, I see,
Oh.
okay, I got you.
That's why.
yeah.
All right,
So it throws the
That
formula
makes
off.
sense. Yeah.
okay. All right,
throws the whole percentage off.
But that's a good catch to look at, for sure.
Okay, anything else for health and wellness? Anything at all? Well, I hope you weather the storm. Now, I understand there were 2 tests at Shutter Creek, and one came back negative, and one we were supposed to get the results today. Do we know what the result was on the second person yet?
I've not heard.
Okay. Well, we'll be awaiting that breathlessly.
Yeah,
It's really, we haven't had any other than the one at Shutter Creek, which was transferred back out.
right.
Cool. Yeah. Okay, thank you, health and wellness.
Thanks.
Before we recess for tomorrow, any general discussion about what we've had for the last 3 days? John, Neil, Greg?
So we're still at that $1.8 million
Yeah, we are.
deficit.
Yep, we are. Since we didn't have any general fund today, we're still at 1,861, I think. And
I thought maybe
Change.
Megan pulled a miracle off somehow during the night, but not.
well, yeah, I was dreaming of that too, but apparently it didn't happen.
I sincerely apologize, John.
Try to do better tonight, for God's sake. You know, I thought the forestry's budget was kind of encouraging, and then I got, well, that doesn't really drop to the right into our bottom line for this year. It goes in, it would reflect in the 5-year rolling average, wouldn't it?
No, it does directly affect the year,
Oh.
because
Mhm.
the formula transfer is based on whatever the 5-year rolling average is, minus whatever their budgeted expenses
Oh,
are.
that's right, yeah,
So,
okay, I'm sorry,
yeah.
I always think we subtract that, yeah, gotcha, thank you.
That was a big help. I think it was about remember right, 170 something?
It was 100,
Oh, 100,
yeah.
okay. I don't know why I was thinking 170.
Easy for you to say, Bob, you don't have to live with Lance telling me how much he helped out the general fund for the rest of the year.
That's why you have it now. Anything else for the last 3 days you want to comment about or discuss about?
Do you want to look at the schedule for tomorrow?
Sure. Look at the schedule for tomorrow.
Do you want to advance some of those forward and give us some discussion time at the end? Or just leave it go?
We have all the law enforcement tomorrow.
DA and
Sheriff, yeah, the jail. So Craig will be on the hot seat. He's looking at me.
Have to wake him up so he can make a presentation.
It's gonna be a long day tomorrow, I think. Now, I did talk to the sheriff about, doing abbreviated like we have been, not going through every line item like in years past, which helps a lot. Just take what was a big increase and what was a huge decrease and talk about those rather than every line item. So we should go through fairly quickly. And then, I think we'll run through, right?
So, Sheriff, are your people available in the morning in case we do get done before lunch and have you?
Most of them will be.
Okay, so we can just kind of play it by ear who's available to come in the morning.
And after that, then we gotta start over again. Being the 1,861 and change short.
Is there any big plans to come up with that, or?
Well, last
Maybe.
year you had some state funds that come in at the last.
We did get an extra, almost 100 on SRS funding, but that's already figured in. Yeah. So,
Played that card,
yes, we did. So,
All my cards are on the table.
it's not gonna be fun tomorrow afternoon. I would plan on, well, we have a meeting at 4 o'clock tomorrow with forestry. The Board of Commissioners does, that was requested by the forestry department. So that may enlighten things. Are we're scheduled for Friday too, for budget?
If needed,
If
yes.
needed, okay.
There's no department.
So probably it
scheduled,
will
but-
be needed, I'm guessing. Trying to find where our balance point could be. And that's not gonna be pretty. It's been the last few years just a really nail biter.
I guess everyone's on their own opinion, but try and find a balance between a little money here and there between capital improvements and this and that, and try and avoid staff cuts
Yeah.
where necessary. Where-
Yes. Yeah, and maybe even some staff not refilling. Not cutting, but if people have left or are going to leave, not refilling those positions. And that really gets difficult. So some of those departments, even if they lose one, they're kind of departments kind of no longer exist really. You've got like 3 people plus the surveyor and the surveyor's office. You've got 4 people plus the county clerk to do elections and do all the clerk's recordings and everything. If you lose one in the elections or one in the clerk's office, and you have vacations and things, or sick, somebody gets hurt, or whatever, basically you've wiped out that section of that department. Same way was there one person in the treasurer's office besides you?
No, I'm the only one in the treasurer, in finance.
What about Katie?
She's
What
only
does
there
she do?
part-time.
Katie's in finance,
Finance,
Heather's in
okay.
finance,
Okay.
and then the
And
three
then
tax
tax
people.
office, there's
yeah,
what, 3 there?
3
Yeah,
that
and
collect,
there's what, 14 in the assessor's office?
yeah.
And they're doing cartography, doing all the redoing of the maps every time we have a change. There's one reading the deeds, in other words, they put into the computer who sold, who bought, and which property it was, that sort of information. Then it gets transferred to the data analyst, who then records all the sale prices and categorizes them into different groups, residential, commercial, farm, all that sort of stuff. Then you got veterans, you got farm forest folks, and a whole gamut of things besides the chief deputy assessor and the assessor. When I was there, and that wasn't that long ago, I left at the end of '08, there was roughly 32 people in the assessor's office. Now there's 14. So I know computer automation has really helped a lot, but still.
I think it's been brought up in the past, but as far as what's statutorily required,
Mhm.
we're providing bare services now.
Right,
Is that, would
right.
that be a correct assumption?
Yeah,
We're not providing any extra fluff that's
No.
not necessary.
no, I mean, we're barely keeping the sheriff going with 98 beds, and that 98 beds costs us more than a total by $1.1 million more than what we get in property tax.
Could we drop the beds but down to
You
something?
could go to 48, but then you're gonna let out a whole bunch of people. That's, I'm not real keen on, putting people out there that are preying on the public.
So I guess
What are the most, to me, the two most important things are being able to do your commerce, in other words, get to work and back and do your business and have goods and services come into your business and flow out of your business, et cetera. And safety. People need to be safe when they're out on the streets or in their homes, et cetera. And then everything else is important, but it kind of is lesser to me, anyway. So, and then on the ballot coming up for this May, we have the radio system. That would be an extra 20 cents, 1,000 of taxable value. So, on a $200,000 taxable value on your house, you would pay an extra $40 a year for 5 years to replace a radio system which supports, see if I got the numbers right, 15 fire agencies, 9 police departments, and 3 ambulance services out of the 4 ambulance services for the entire county. And it's failed 5 times that I know since last July. And we're getting parts, used parts off of eBay to keep it going. You know, if we had some extra money, we would have bought that radio system and put it in. It's not there.
Does that provide for buying any towers? And
No.
That's still renting tower space.
In certain instances, some of them we already own, but in some of them, it's like $1,500 a month from American Tower. Like, example would be Blue Ridge. Now, we are going to have a big advantage because the Sheriff's Office and CFPA, Coos Forest Protective Association, got together, and they're gonna co-op. So we're gonna be able to use their towers to have better coverage. And then the city of Coos Bay and North Bend bought in, because there's gonna be some upgrades for them too. So eventually, we don't have have to call them on a different,
Frequency.
well, actually, just call and find out, what's going on. It'll be pretty much seamless, the whole system. Although it has to be analog system instead of digital, because digital is basically line of sight. We have too many hills and valleys to have decent coverage. There are grants out there, we've tried for several years to get grants for digital, but not for analog, because everybody, the federal government wants everybody to go digital, but then we'd have to have 2 to 3 times the number of towers. That doesn't work out too well. So they decided to go with analog, which is, the system they're going with is analog, except that it can be converted to digital rather readily. So it'll serve both purposes if necessary. So, our task is to find $1.8 some million in the next few days.
How much of the 4-H budget do you, or do we pay for, and how much of it is like, state?
The county doesn't pay for any of it.
It's all property tax
It's,
funded.
they have their own property tax.
Base.
The library has their own property tax. We used to have CCAT, which was totally funded by grant funds, but now they're on their own.
Well, that's right. Last year they were through the budget process. And
You didn't see them this year, did you?
Yeah.
Because they have
Standalone.
branched out and they're on their own. They're taking care of their own business, and that's instead of us being overarching of them.
So I'd have 2 questions for tomorrow, at least for the potential would be, what's the savings to go back to 49 beds?
Okay.
And the other one would be, what's the potential savings if we don't fill potential retiring positions?
Well, we need to talk to HR about the retiring.
I don't know, we need those
Well,
numbers,
we were
but that
told by
might be
the
something.
assessor there's gonna be somebody retiring at the end of August, but I do know somebody quit the other day. One of the appraisers up and quit, and is gonna do whatever they're gonna do, so possibly 2 positions there. But I don't know how many you can't refill in the sheriff's office without doing coverage. That would be a question for the sheriff and or jail. And a lot of those, like the Marine and Dunes, are totally paid for by,
Not totally,
well, mostly,
yes.
correct? Mostly paid for from the Marine Board and or the U.S. Forest Service.
But we had, just a couple of years ago, we had 49 beds.
Yes,
We knew
we
what it
did.
cost to run the jail then.
Right. I can try and find that out.
Just rough numbers, and I don't know if you had, if HR knows that there's, 3 or 5 or 6 people planning on
Mhm.
retiring in the next year, that might be
And if,
interesting to know.
I don't know how many layoffs you would have because of that, and then how much unemployment
Unemployment,
we
you
would
gotta
have
bump
to
up.
pay, because we're self-insured.
Right.
So it's not quite simple.
And the retiree thing is really hard, because at
That's correct,
and change their mind.
yes.
So that makes it really difficult.
Mhm.
There's one kind of neat thing about when a person retires is that new person continues with the state level, the one that retired,
Mm-hmm.
Sure.
up a little bit, but, you know.
But I'm just saying that's, I don't know that you can count on that just because there's a lot of unknown there.
So what is the typical roll-up cost versus salary note percentage-wise? High 40s%?
It,
But
I mean,
while
it
you add
varies.
together insurance and PERS and, just a few spot checks cited, it's 50% plus.
Mm-hmm. I remember not too long ago when it was 30.
That,
John?
those two things.
John?
If you have social security on top of that,
John?
that's another 7 or 8%.
Not too long ago, I remember it was 30%. That's not that long ago.
It's been a while.
The same,
No.
I think the same discussions since I've been on the budget committee, it's that healthcare and retirement PERS are increasing faster than,
Oh, wait.
Yeah, we can't,
you can't keep up.
it's getting away from us.
You know, recently we have stopped raising the caps for what the county pays for insurance.
Mm-hmm. We just can't cover the insurance costs anymore. We're gonna have to ask and we do in certain cases, ask the employees to cover part of it. Because it's going up so rapidly. And our revenue's not going up rapidly.
You know, I've kind of taken a look at that over the years here. It seems as though our human resource, our personnel costs increase about 5% a year. And some of that, throughout the public employee unions, you have these step increases and longevity increases. So that all adds up. And you add health insurance and PERS, which both go up at pretty high rates each year. You get to 5% increase. And out of our general fund, just keep the math simple. I know it's more than that this year, but if we had a 20 million general fund department total budget, 85%, which is normally personnel, that's 17 million. Increase that by 5% a year, that's $850,000. And in the good year, we get about $150,000 increase in property tax revenue.
Mm-hmm.
And, our citizens at some time are going to have to make a choice. There's a possibility of a tax base increase, but just to put how big a tax base increase it takes, think about Roseburg Forest Products' $50 million expansion at their Coke Hill plant a couple of years ago. That's a lot of money. That's 50,000 thousand. So we get a little over $1 per $1,000 of assessed value. All we got out of that $50 million expansion was around $60,000 a year. Doesn't even pay for one person.
No, it's half a deputy cost.
It takes something giant like Jordan Cove. And
Well,
there's
and
been a lot of resistance to that. There's been a lot of resistance at local level. There's been a lot of resistance at the state level.
one of the things,
That would have been a nice thing for us to have had, but I'm not sure we can count on that.
yeah. Well,
It boils down to three things. You got to increase your tax base. You got to increase. We've cut to the bone as near as I can tell. So what we've got left to work with are an increased tax base, an increased tax rate, or a reduction in county services. But as Bob said, we've pared so far down do we cut any further there? Other than in public safety, which is in essence saying we're going to reduce one of the most critical services the county provides. But, you know, we've done that, I think, you know what? I think we've all done a really good job of enhancing non-tax revenues, controlling costs, slashing personnel. I don't know where to go. We're down, and Jordan Cove isn't going to happen this year. We might get some relief the year after this from some of these timber lawsuits we're involved with. But they aren't going to happen in time. That relief isn't going to come in time to help with this coming year's budget. So we're down to two things. Slash personnel. And I don't know where else we can do that but in the jail. Slash personnel costs. Kind of across the board. Hopefully temporary. Furlough, you know, work fewer hours per week. Or reduce services, which means slashing personnel. Or increasing the tax rate, and that's not going to happen in time for next year.
And we,
So it's a tough spot we're in.
we have the second lowest tax rate in the state, and rightly so, because back when ONC timber was being harvested, we typically got 14 million a year. And that's a long while ago, so 14 million is a lot more today in real dollars. So with inflation, we relied on those ONC dollars, which have gone away, and we gradually tried to hang on and hang on and hang on, hoping that something like that would come back. But it hasn't yet.
And it's not going to this year.
No, it's not going to this year. None of those things.
That doesn't help. It doesn't make it any easier. It's just a kind of overall perspective of how we got where we are. And the alternatives are not particularly attractive to balance the budget for next year, in my mind.
Okay, so everybody think about it, and we will have law enforcement tomorrow.
Okay,
Oh, Greg,
yeah, well, Lance was saying that he can log 350 acres a year forever
yes?
and sustain the forest. Well, just on average year, what would our net be for that?
3 to 4 million if the market's there. But you have to, right now, it's kind of sketchy as we're gonna have people buy, because there's not many games in town anymore.
But if you don't have a sale, then the timber just gets bigger and there's less people that are interested in it. It might drive the price down further.
If
It's a
it is
careful,
that stage, yeah.
careful dance.
Yes,
there.
it is. We were fortunate a few years ago when there was a big demand, and we cut a lot of stands that weren't highly desirable and got some good money for them. I don't know, but it seems like we've kind of run out of those. We have some good marketable trees, but the market isn't quite there right at the moment. It always fluctuates, though. Every few years it goes up, it goes down. You know, I think, in my memory, we've had two years where we didn't have any sales at all because there's been a giveaway at a couple $100 a thousand, which it's just throwing it away. So we held
And
off.
Greg, the other thing about that is, even if we had a good market right now for logs, which we don't, we're still cutting timber that's 60, 70 years old. And a lot of that is too big for local mills.
Except
And we've run a program to increase our harvest rotation. We've been at 50, had been for a long time. And now we're at 40. But whether it's 40 or 50, instead of getting, let's say, 40,000 board feet to the acre, which we're getting when we're harvesting 60
Unfortunately, that's what the market is, though.
That's the type of log that the industry seems to be manufacturing. And so it's going to reduce our per acre harvest. Now, although we'll be harvesting more acres, but it's not going to be generating the same amount of revenue going forward that it used to when we had markets for those bigger logs. And again, I would emphasize, if our forests were all dug fir, there'd probably be some markets for those bigger logs, but it's not. It's heavy to spruce. And spruce is not a desirable species. The only thing they use it for is the interior plies of plywood.
Mm-hmm. And
And
you can't export it, so,
so we don't get a premium for for a large spruce log that you might expect to get for a larger Douglas fir log.
But a few years ago, sorry to interrupt you there, John, correct me if I'm wrong, but a few years ago, didn't you and Lance, or whoever the liaison, and Lance and their advisory committee step up the logging of those larger spruce, and was it a 5-year plan to try and clean up or get rid of some of that larger spruce?
Yeah.
it was a better market back then.
Better market then. We had we have a sustained yield of about 350 acres a year. And it's based just how many acres we harvest. We've got roughly 13,800 acres of that number's close, of harvestable land out on our 15,000 acre forest. So you simply divide 40 into 13,800, what do you get? 13,800 acres, and if you're on a 40-year rotation, that means that's only 345 acres a year, so my number's off a little bit. But that's where that 350, 360 acres a year number comes from. When we were on a 50-year rotation, it was about 13. We had about 275 acres a year harvest.
Okay.
So we're not harvesting a certain amount of wood each year. We're harvesting a certain number of acres each year. And but as we work forward into this 40, 50-year rotation, the volume per acre decreases. But that's the size of log that we can sell locally. And if we sell it further away, it costs another $60 to $80 per thousand trucking to get that log to Roseburg or to South Coast Lumber Company or to Eugene.
Mm-hmm. D.R. Johnson down in the Tri-Cities.
Yeah. So that's where we are. I'm proud of our county forest, but we're kind of in an area where there's not much tension in the market for logs. Now Neil's in a better position. He's closer to Roseburg. But we're not. We're about as far away from Roseburg as you can get without going to sea. And I use Roseburg because that's the next nearest market.
Mm-hmm.
Other than export, and we can't export.
Right.
So back to the budget, I know we've transferred money from the trust, is it the Parks Forestry Trust in the past, is that correct?
We can't spend that money. It has to be used
Back into
for-
the forest.
Back into the forest, yes.
The rolling average is what we were spending.
Yeah.
Okay.
What's the average that county forest actually contributes to the general budget?
Since I've been
Megan's gonna look it up.
Somewhere in the budget, I think I've seen where there's basically a running average dollars that are contributed.
Didn't Lance add that?
In the fiscal year 15-16, we took $3,714,000 out of the forestry fund. The next year, $2,008,000. The next year, $4,003,000. The next year, $2,009,000. And this year, $3,003,000. But in most of those earlier years, we were taking extra money out of it, money that we, from years where we hadn't used it all.
Right.
So that wasn't, that was something that I know that I don't, my numbers here don't show what we took out on that formula.
I can pull that up, just give me 1 second.
But I guess my whole point is the $1.8 million that we're short now would be amplified by a bunch without the county forest.
Correct.
Oh geez, yes.
Yeah, you'd be at 3.5 or 4 million.
Right.
Yeah.
So the formula has ranged from about 2.8 to 4.7 over the last, since like fiscal year 2014.
Okay.
And currently, we have 3.3 rolled into the,
Yeah,
Current
scratch
budget.
that.
hmm?
2.1 to 3.6. I was reading the wrong column.
Yeah, I was wondering. So our formula payments have ranged from 2.1 to 3.6, is that what you're saying?
Correct.
And currently,
Yeah.
we've rolled in 3.3 for this coming budget.
3.6.
Oh, 3.6, okay.
I'm sorry, repeat that. 3.6 is the high or the, for this?
Is the high,
Mm-hmm.
and it's also this year's.
Yep.
Or next year's, yes.
2021.
And then the formula drops off, I think.
Probably, because we haven't had the sales.
So, this year, in the proposed budget, you see 6.15, but that consists of the formula transfer of 3.6. 400,000 is excess expenses from previous years that forestry didn't spend their whole entire budget.
Okay.
And then the extra to balance the proposed budget was 6.1, or sorry, 2.1.
So I would suggest for the budget committee, after we get done with the sheriff, to maybe you want to wait around till we have our meeting with the forester at 4 o'clock. And see, learn about that discussion.
I'm pretty sure whatever discussion you have, it's not gonna generate 1.8.
No, but I think it'll be highly informative for the budget committee.
You just can't make any comments.
Yeah, you just can't chime in. Well, you can, not as the budget committee,
public.
just as a citizen in the audience, you can ask.
Except you have a quorum of the budget committee present.
Well,
Yes,
that's
it's
true.
really-
Yeah, that gets dicey.
yeah.
So just listen, I guess.
So this is off the subject, but, selling the real estate we talked about last year,
Mm-hmm.
what happened on, have you moved any?
Yeah, they sold, what was it, 4 million?
You're referring to the annex.
Yeah,
Well, We have actively tried to market that, and it's, not a lot of interest. And then we would have to take most of that money, because we still have one courts over there, bring them over here someplace.
And spend the money to set them back up.
Yeah. Which has been discussed that the sheriff would go into the jail, the whole sheriff's office. Planning and veterans would go into the sheriff's office. Commissioners, HR, council, that area would come over here. And courts would go where the commissioners, HR, and council are. That one courtroom that's over North End.
Okay, but to make it
That'd be
simpler.
natural to just
Make it
continue
simpler,
expanding.
you could probably find something in Coos Bay North Bend, small, that was the right size to just move your existing services that are provided there now into it. Without having to do all this.
Maybe.
Playing,
Oh, and
musical chairs with all the other departments.
and maintain an old building and worry about all the riffraff they're having to chase out of there. Rent a commercial space.
I mean, you're a downtowner, there's downtown Coos Bay, there's downtown North Bend, there's places that we could pick up.
Those are all good discussions to have, I think. We're not quite in the time frame to have those at this moment, but they're good discussions, good ideas.
So, I just wanna throw something out there, cause I heard it mentioned, the whole 36-hour work week. It's not really a possibility with union employees unless we rebargain every union contract.
So the only thing that you might save is the
Non-union.
non-unions, which is a very small dollar, I would assume.
In this grand scheme, yes.
Well, like when you go to a union, you could say, well, either we gotta do the 36-hour week, or you're gonna have to say goodbye to one of your constituents,
Or
10% of your constituents,
there is one thing that I thought about that we could take from solid waste. Do they really need a new roof of 1.2 million?
It's
Over
got
the pit?
holes in it. I was out there yesterday.
Hmm?
I was out there yesterday.
Yeah, but the roof protects the garbage, and I'm going, huh?
I think
When it goes to a landfill in Medford,
I think it was established that it's a DEQ requirement.
well, the roof is still there, isn't it?
The question might be, could you spend
Whether-
100 and
How
patch
good it
it?
is another matter, but, huh?
Could you spend 100 and patch it?
We
Well,
had an architect working on it last year, figuring out what to do.
I looked at it for the main uprights, et cetera, framing. It looked pretty good. I mean, it's really thick steel. It's the roof cover that's the issue, and they wanna replace the whole thing. But I'm no builder and I'm no architect, so I don't know.
Well, the tin work on the roof could possibly be patched to get you by a few years.
It's pretty thin. I wouldn't want anybody walking up there. In a lot of spots, you can see through it. But there is 1.2 million there that's sitting here for a new roof. Do we have to have a brand new roof? Well, we meet the requirement of a roof, but it isn't real good. But
I
I'm
would
still,
guess that-
still having trouble with DEQ saying we have to have a roof when we transport Medford to Dry Creek and it's out there in the open. Huh?
Well, there may be something that if you don't have a roof or the roof leaks substantially, then you need to monitor and control the water runoff that's
Yeah.
running through the garbage.
I
And
got that part.
Going out into the soil
And the weight, the amount of weight you're
Is that what it's
transporting
called?
in the
Transport.
wintertime, I got that.
leaching.
I got that. But
Let me weigh in for a minute. I was around here a couple of years ago. We took a look at all those things. And we know we can't do without a roof. It's a DEQ requirement. Even if we could, we'd be paying for every ton of garbage we take in the winter at least. We'd be probably hauling way more than that in terms of garbage and water to all the way to Medford. So that doesn't make sense to do that. Besides, we can't do it because the DEQ says no. We took a look at replacing just the roof, and it's not just the tin roof that has to be replaced, it's the purlins that hold it up that have to be replaced. And the contractor said, you know, once you get into that, you might as well replace the whole thing. We could take another look at that and double check that to make sure that that's was the case, but that's the input we had at one time. The cost differential of replacing the roof instead of just redoing the whole thing was pretty minimal.
Do we have something
I'm
from,
against dipping into that fund because we're gonna have the same problem next year. And they've been saving up out there to have that, and which is the right thing to do, and then to take it away from them, I think is the wrong thing to do.
well, do we have something in writing from DEQ that says we have to have a roof?
Yes,
I'd like to see that.
it's DEQ, yes, we do.
So we have that somewhere in the files?
Pardon me?
We have that letter somewhere in the files about that?
No, we've been told that.
Well, I want to see it in writing. Because when I was the assessor in Department of Revenue, they'd call up and tell us we had to do something, and we'd do it, and 6 months later, say, oh, no, we didn't say that. I made it a policy, anytime they told us to do something, you had to do it in writing.
Okay.
So they couldn't back out, and a lot of times, what they told us, what came down in a letter was substantially different.
Yeah, okay, I'll look into that then.
Yeah, that'd be good. Maybe there's even a grant from them. Being we're up against the rock here.
And then you go from a leaking problem to a safety problem.
Well, but the problem is that doesn't fix our problem.
Well, not long-term, no.
We'll blow through that $1 million in another year or two.
Yep.
Well, it'll all be gone this year.
So this,
And then where are we next year?
this current proposed budget would be gone, yes.
Yeah,
Well,
this proposed budget would consume the whole $1.2 million they're putting into, that they have planned to put into that. And we're right back next year where we are right now.
yeah,
I'm tired of passing this budget. And we're not being realistic. And at some point in time, the people of this county, unless we get a huge increase in our tax base, over which we have no control, are simply going to have to decide, do you want to continue living in a county where you have a county tax rate that's 40% of the state average, which means this is a pretty good place to live and do business as far as what you pay to the county in taxes? Or do you want to do without the services we provide? And when you look at the services that we provide that we can cut that would make a difference, it's not a pretty picture. But I think the citizens that have got to realize what the situation is and either accept the consequences of a reduction in county services or pay a higher tax rate. And anything we do to patch this year is just going to bite us in the ass again next year.
Well, to follow that same line of logic, then we'd either go back to the 49 beds as soon as possible and save money, or and reduce staff now?
Well, we can look throughout the county. I don't know where else you go. Obviously, you gotta be able to, people have to be able to vote. So and you gotta have a place to file your documents.
Yes.
So I don't see that you can cut too much, any in clerk. You gotta be able to meet your payroll. You gotta be able to collect taxes. You gotta be able to appraise the property.
How full is the jail now?
There's nothing, we can't eliminate the assessor's
Half.
office, eliminate the road department, but
Third?
that doesn't do any good. It's not general fund.
Hang on a minute, John. Greg asking how full the jail is. Now, do you mean of the 98 beds, how many are occupied?
Yes.
Or the capacity we have of 250?
Well, I was just, well, that'd be.
The jail has a capacity of
I was just thinking
250.
that maybe we could market ourselves to, because you got other counties that are hurting, and we could become,
Correct.
I think
You know
we've
what
had
I'm
this
saying?
discussion in the past. It's
However-
too far off of the I-5 corridor to
Correct.
transport them
That's right.
efficiently.
Yeah. When they built and expanded the jail, everybody else did the same thing up and down the I-5 corridor. They were, commissioners at that time were expecting to get federal prisoners, and, well, we were in the mix with everybody else who expanded, so they didn't have to come over here. So I have texted the sheriff to find out what happens if we go to 90, from 98 to 48. What are the numbers? What we were talking here.
Well, or the other, and I don't know how the numbers and the personnel work, but would the citizens be more comfortable with leaving it at 98 beds and reducing patrol? I don't think patrol is statutorily required,
No, it's not. All you have to have is a sheriff.
and serve papers. Because the cities are gonna squawk also,
Sure.
if you go back to the, Megan has something to say.
There are a few patrol deputies that are paid for by, like, the timber operators.
Forest,
Yeah, and then,
marine,
marine and
dunes.
dunes, those are partially paid for.
Mhm.
So, you kinda have to look at that, but I mean, if you just reduce patrol, obviously they're somewhere in there.
okay,
Yeah, you got two people, I understand we have two patrol people on duty, 24 hours a day, 7 days a week. So I don't know how many patrol people it takes to do that, but it's not a great big number. And in the jail, I don't know how many people it takes incrementally to run this one more pod.
Well, those are all good questions to write down.
Days and all
Those are
that,
all sheriff
and that doesn't go
questions.
down, it's just the people in one pod. I think it's something, is it like 3 people
I
per
don't know.
shift
We-
that are on in the pod?
That would be good questions to write down for tomorrow.
Yeah.
Okay. And then you have the DA's office. They're struggling to keep up with the number of people who are trying to prosecute.
But
If you
there
don't have
is,
jail space, you don't need as many DAs, assistant DAs.
And then you've got juvenile too.
So,
It seems to me years past juvenile's budget isn't, it's not, there's not much there, is
No,
there?
there isn't much.
no.
there is a vacant position in the DA's office right now.
So that's 2, with the one in the assessor's office,
Mhm.
or the potential one in the surveyor's or the assessor's office.
There is one
No, there is one,
in the assessor's office right now.
and then a retirement coming possibly in August.
From the DA's office?
From the assessor.
From the, okay, so that's 2, yes.
And then there's an open position in DA right now.
So that's, we're up to 3.
Yep.
That's about $300,000.
Yeah, it all adds up, all helps.
Okay, any more discussion about this, how to try and balance?
I think this is a good discussion.
This is Neil.
Yeah.
We're right back to basically exactly where we were the first year I was on the budget committee, where we were asking departments to make 10% cuts. And basically, we're right back there to where if you cut one more out of survey, they basically, you might as well not have the survey department because it can't function and do the job. And I think that reflects through to other departments as well. I believe the number was a 5% average roll-up cost in benefits and salaries. Just since I've been here, it's either 30 or 35% roll-up costs is where we are in the overall budget. And I guess the question I have is we're down as far as general fund dollars go to start picking and choosing what services we provide and what services we don't provide, because I don't think we can effectively cut. There's no way we're going to make up enough difference in this budget to cover the deficit that we've got currently, the 1.8, without cutting personnel. That's the only place that we can do it. And I guess the question I've got is what departments are mandated that we have to have and what departments aren't, and start looking at exactly what John just said, decide what services we can provide and what services we can't provide.
And then you gotta keep in mind, the non-general fund departments, it doesn't help our budget to cut them at all.
Doesn't help at all to do that. It basically all has to be general fund dollars that we're talking about.
As a
But
matter of fact, it hurts because they help us pay for some of the overhead we have to have in payroll and other, and county council, other essential administrative services. So,
With the cost allocation, everything will get pushed back around. Okay.
What percent of land percentage is owned by the federal government in our county? Just roughly, like
About 50%.
almost half,
Mhm.
and they pay no property taxes.
Correct?
They pay
Well, they pay,
a little bit here and there, it's there, we have in
But-
lieu of property taxes that we
Yeah.
get on some of the lands.
on the wagon road, they pay in lieu of, and we are currently in dispute of how they pay that and how much.
this year it was $234,000,
Yeah.
and it all goes to the road department.
Right. It's
And I
supposed
don't
to,
know that we don't have a lot of latitude about where that money goes. It's dictated by, the federal, one of the federal acts involving the Coos Bay Wagon Road land.
Mhm.
That's where roads, bridges, schools.
Right.
But there's a line item in the general fund, for revenue that starts with 333. We get, usually around 670-ish thousand for, in lieu of property taxes from the federal government.
Has anybody ever figured out, based on the ownership, what that'd be if they paid the same rate that other like tax payers pay?
That's a great question,
Megan will run those numbers and send a bill out this afternoon.
yeah. Well,
I don't know what the land's worth. I just collect the taxes. We don't come up with the values.
Right.
Call Steve.
well, I just wonder if there's somewhere in this country where the county charges a county road fee for vehicles, you know, that aren't covered, that aren't
trying to get money out of the,
Federal government.
do you wanna toll the federal government, the roads in the forest land that they don't,
No, they have to drive on county roads to get to their property. And they're not paying a penny for that.
Well, and
Well, they're paying
the,
some.
the trick to that is if you're gonna charge someone for driving on a road, it's gonna have to be, the money's gonna have to be used to maintain that road.
right?
So it wouldn't come into the general fund, it would go to Public Works, is normally how any type of that,
User fee works.
yeah.
It would be the sheriff too, because the sheriff patrols that road for them. And he also, I mean, like, if there's an issue on federal land, does our sheriff go up there and deal with it?
There's deputies, aren't there? There are forest patrol deputies?
We do.
Yeah, so.
And we get
We
money,
don't get paid for that either.
yes, they are,
We got-
they are.
we got
get
title
money
money.
from BLM,
Oh,
We get
okay.
directly reimbursed for that.
yes,
Oh, okay. So that's
we
good.
have contracts with them.
That's good.
And we have contracts with private timber companies too, don't we?
Correct.
Yes.
Yeah.
In fact,
I think we're
Weyerhaeuser
not
just
the
paid
one
for an
that's
entire
gonna pay for
deputy.
An entire employee.
right.
Maybe they'd like to.
Yeah.
They just went from a half to one, so they're probably okay for a while. Timber prices down, they're probably wondering why they did that.
We have another call due. There were board meeting.
We're discussing what to do with our budget based on the last 3 days of,
Did you guys figure it out while I was gone for an
no, we
We
haven't.
were waiting.
We're waiting for you with the magic numbers
I'm sure enough, you guys figured it
and
out.
finding where the hidden money is.
They did? Oh, sorry, I said everything.
Because there's no magic solution.
Recover distancing.
We've discussed the roof at solid waste. We've discussed cutting back the jail from 98 to 48 beds. We discussed increased property tax proposal, my whole gamut of things. What?
Logging in the county.
More logging in the county, although who knows who we're gonna sell to, et cetera. There's no happy number out there.
You know, if we had a real answer that we knew would see us through, I wouldn't mind taking a little more timber, but we don't. The same thing with Robbins Solid Waste for their new building. I wouldn't mind doing that if we knew it would tide us over for one more year, but it won't.
Those are options that we've already done several times over the last 5 or 6 years. Similar type options where you take more out of the timber fund or you rob money from this project or that project, balance the budget, but it doesn't, those don't solve our problem.
I had, you know, I justified doing those types of things because I had high hopes that Jordan Cove would come. But I'm tired of gambling on that.
Okay, so be thinking about all that and thinking of your questions for law enforcement tomorrow, and we'll be back here tomorrow at 8:30, and so we are in,
Oh, before you
Well-
recess, please, we need to set a time for compensation committee to meet,
okay,
so we have to advertise that.
after the,
So Friday.
Are we assuming it's gonna get all finished up tomorrow?
no,
We'll be back here Friday.
I think we're assuming Friday,
I think
probably
so.
Friday.
because law enforcement usually takes a while. But
Mhm.
yeah, it's a good question, Sven, because I'd hate to drag you guys back on Friday if we did get it
And we're gonna have a
finished.
discussion with forestry at 4 tomorrow,
Yeah.
so probably Friday.
Hold on. How long did law enforcement take us when we covered it? Do you remember? I I think we were done by
And the
afternoon.
compensation committee needs to get together with HR with the new law that the legislature passed.
Oh, do we?
Oh, yeah. That really threw a monkey wrench in things.
Once the time is
That's where we were
decided
done by
on
like 2.
Caroline, she
Yeah. Then
That's
she
where
can
we
fill
were
you
done by
in
2.
on the new law about compensation for employees from the county, which includes electeds.
We don't know how long it's gonna run on Friday, so.
No, we don't. You might wanna just pick a time and
So you can always
The
start
budget
it,
committee
you
can-
just couldn't start it before the advertised time.
the budget committee could recess and you could go into compensation and then come back out and we could come out of recess on Friday, if you just wanna pick a time.
Let's do like 9:30, so I mean, if we do get done early, they're not stuck waiting.
Okay. You want 9:30? You have to get together
Since we
with
can always do
Caroline.
later, if we have to.
Mhm.
Oh, so do compensation committee first, and then come out of recess with the budget committee?
Yeah, we could do that, if that's, or, you could even schedule it for 9:30, and then
We'd
if you
recess.
can't get to it till 10:30, it's fine. We just can't
You can't
set
do
it for
before.
10:30 and hold it at 9:30 because we're done early. So,
Alright.
Is there anything that you won't know by 4 o'clock tomorrow afternoon that would impact your compensation committee's decisions, that you'll know the next day? I guess another option is for you to meet, while we meet with the forestry department. And then
Well,
that
they're
would
gonna-
save you having to meet on Friday.
They're gonna have to get together with Caroline between now and sometime.
Yeah, we might wanna give Caroline a little bit more time to
Yeah.
Okay,
get everything together that she has to get together
all right.
as a courtesy.
9:30 on Friday, does that work for you, Neil?
Yeah.
Thank you much.
Okay. Magic words?
Now I hear.
We are now in recess till tomorrow at 8:30.
Can hardly wait.
And write down all your questions for law enforcement tomorrow.
Thank you.
he's got like 3 things.
Anything that I need to be here for? Or can I back out?
I don't think that's, I don't think you need to be here. You never know what's gonna come up though, so,
Hello?
and I think it's,
Oh, you're still on the line, good. Yeah.
Came back. Thank you.
Put my earrings back in.
You're in charge.
I know, I'm putting my earrings back in. And I'm letting
Bobby,
Megan pack up.
the batteries have died in this other.
And I'm gonna complain about a lack of pizza.